one reason that it is especially powerful to me, obviously besides the fact that I'm in recovery, is that I had the feeling that my children were going to have some problems. And my son is also a recovering meth addict and alcoholic. He is in recovery. His wife is in recovery. I have 2 beautiful grandchildren. My niece is in recovery too. And one experience I want to share with her, she was in recovery, and she was involved in the child welfare system. And she was about, I don't know how far along, 6, 7 months pregnant. And she relapsed once out of that entire 9 months of pregnancy. She relapsed once and had 1 use. And she was really devastated, and she went to her doctor, and she said, you know, I've used, I relapsed, I feel so bad, you know, what's going to happen? And he said to her, you just fried your baby's brain. Sit down, I'm calling child welfare, don't you move. I was devastated. You know, I worked really hard in that community. The information from Dr. Lester and this doctor, and there's so much more information out there, and it is terrifying to me that so many women are still being devastated by lack of education of our healthcare providers, of our social workers, you know, of the people who do services with this vulnerable population. And by no means do I want you to have the idea that I don't believe everybody should be held accountable and responsible for their actions. I absolutely believe in that. But I also know that what we found from the women in the Moms Off Meth group, I'm running out of time, ain't I? One of the things that we found out from the Moms Off Meth group is we decided to catch, you know, what were the barriers to their recovery, and how could we break those or fix those broken links in our community. And so we started gathering this information, and we would take it out in the communities, and all these community providers would get together and say, gosh, you know, well, there's some solutions for this. The supervisor of the Department of Human Services came to the task force meeting that was also partnering with the Moms group. And one system change that we decided to do there as a community, because many times the goal is remove the kids quick, put them in foster care, you know, and then mom needs to get treatment, and, you know, by God, she better get it done. Immediately, she loses, if she does have Title 19 insurance, she loses her coverage, and so she can't go to treatment unless she gets some state-funded facilities, and there's a waiting line for that. So we came up with a contract that when there was a child welfare, a child protection worker, the first people that go into the home and do this assessment, if they went in and found out that there was substance use going on, the women were offered a contract. And they were offered this contract that if they sign it and the social worker would sign it, they would agree to go get their substance abuse evaluation and follow through with whatever recommendations, whether it be inpatient treatment or outpatient. They would go seek mental health evaluations. They would take their children to Child Health Specialty Clinic, which was, you know, a clinic that specializes in children's health issues. And they would agree to all these things and practice in or participate in random testing. Then the Department of Human Services first wouldn't file a child in need of assistance, and they would let them do voluntary services in the Department of Human Services, and the children would stay in the home. And so it was a win-win situation. Obviously, if the women didn't follow through and if they didn't do those things, then the children, you know, needed to be removed, and they would be placed with a family member or foster care, and then they would have to file a child in need of assistance. But it was, you know, it was something that happened in our community, in our system, that we were pretty proud of, because it was kind of breaking barriers. And it was the substance-using women, the recovering women, who were, you know, helping to make changes. Another thing that we felt was really important is if you're in the juvenile court system, or if you're in any system and you're a drug addict, lots of people are writing reports on who you are and what they see. And so we felt it was important for women to have their own voice. And so we empowered each other to write court reports. We submitted them in juvenile courts, and this was a way for the women to say, I'm not just an addict. I'm a mom who loves my kids, and here's some of my history. Here's some of the things about me you don't know. 95 to 99% of the women I've worked with since the Moms Group started and before have been survivors of childhood sexual and physical abuse. There's that barrier, and if you have all of those issues, the minute you stop using, those memories come alive. The feelings come alive. All of those issues that you have tried to kill for many, many years come alive, and they come to the surface. And if you don't have access to services, and if you don't know what to do, your only recourse, if you're an addict and that's the only thing that's ever made you feel or quit feeling, if you don't have access to those services, then chances are real strong that they're going to continue to use. Research also does prove that women who use while they're pregnant, substance-using moms, I can't remember the exact number, so I won't quote it in case you're taping this. I don't want nobody to get me later. But the huge numbers of them are sexual assault survivors. Huge numbers of women who use while they're pregnant are sexual abuse survivors. So we began to get that information out. We attended court with each other. We started doing community presentations. We also went to the state, to the Capitol, and did presentations with the House committee. And then a few years ago, we went to the Washington, D.C. to talk to the House and Senate staffers. We've talked to the Office of Drug Control Policy. We've talked to, anybody who will listen. We want everybody to know that, we really do have some good information. We have some good experiences. They were talking about, when they invited me to speak, I see the list of everybody's, all their credentials and everything they're having besides mine is, it really should just, I have a social work degree in human services, and I don't have a MSW, and I don't have a PhD, but I do have a lot of life experience, and that life experience has really, it's been hard won. I certainly wouldn't recommend it for you guys if you're thinking about going out there to get that kind of a degree. But you know what? It was my story, and that's the way my life has, driven me to be an activist for women who are substance using. And the Moms Off Meth group, is not a be-all, end-all solution, so I don't ever want everybody to think that, start a Moms Off Meth group in Oklahoma and everybody will get sober and all will be well, kumbaya. It's not going to. It was a great place for women to have a safe place to talk, a safe place to share, where nobody wrote a report and nobody called the social worker and said, she's still struggling with being involved, she's still struggling with this, she's still struggling with that. She needed a safe place to share vent her frustration, vent her fear, talk about her shame, talk about her guilt, but then move into the solution. We don't stay stuck in the Moms Off Meth group, we move on. We don't think it's healthy for each other to stay stuck and feel like victims. We feel it's really important to know that we have inner strength and we have lots of good things inside of us that are just dying to get out there, but sometimes they're buried under years and years and years of abuse, drug abuse, physical abuse, sexual abuse, things like that, poverty. So we began to be activists in our communities. We do lots of educational presentations. We bring in the experts. We bring in the doctors to come in and do a presentation, although we didn't for a while because nobody really knew what the effects of meth, so we were like, kind of terrified. But we brought in, nurses to talk about infant massage for babies. We brought in substance abuse professionals to talk about relapse, the relapse process, the recovery process. We had the county attorney come in and do a presentation on the juvenile court system. What does a child in need of assistance petition mean? What is an adjudication hearing? What's a disposition hearing? And what does that mean for you? So we did lots of educational presentations. Like I said, we really believe, and I still believe that, women are experts on their own lives. Their answers are there. They're there, but they're underneath lots of years and years of other issues. And so, another thing that we did was we learned how to have fun. Because in the moms group, we would look at, the women would look around, and once they got sober, they would say, sobriety is boring as dirt. What do those earth people do? That's what we like to say. What does the earth people do for fun? My gosh. Do we have to play golf and wear funny clothes? Do we have to bowl? I mean, we really just didn't know. They didn't know, how to have fun in recovery. Because when you've lived a life of intense, just intensity all the time, you take away that intensity, and even though it was tragic and terrifying, it was intense and dramatic all the time. You take that away, and then all of a sudden, what do you got? So we decided to raise our own money and have fundraisers and go have fun. We had slumber parties. Many of us have used since we were little children. We never had a slumber party. So we would drink a bunch of coffee and smoke a bunch of cigarettes and laugh and do our hair and makeup. And that's something that a lot of people did when they were young. We never did that until sometimes we were in our 30s and 40s. And so, we learned to have healthy relationships with other women and learn how to love ourselves, be kind to ourselves, look at the barriers we face in our relationships with the opposite sex. We call it the broken picker syndrome. We had broken pickers. And, what we've learned in recovery is that if we're attracted to them, if we're really new, there's probably something really wrong with them, run. So that was our red flag. If I like him, run. And it's still proven kind of true because, you know, there's been people I'm attracted to, and then I meet them after, you know, I get that first general impression, and they say, I just got out of the halfway house. You know, I'm not going to prison this time, and I'm living with my mom. And I'm like, doing